So yesterday, over 18,000 people were tested.
18,000. So you've got 8 days to get from 18,000 to 100,000 a day. You're not going to do it, are you? In fact, you're not going to be anywhere near it.
So that's against the capacity of 40,000
I don't care about capacity. The Health Secretary assured us 100,000 people a day would be tested by the end of April. I don't care what the capacity is. That's your job, is to make sure the tests get done. 18,000 yesterday is nowhere near 100,000. What happens when we get to the end of April and you've become woefully short of that target? Where's the accountability?
So, well, both capacity and the number of people actually taking up tests does matter, because if we don't have the capacity, we definitely can't hit the 100,000. So we both need to have the capacity to do the test and have people going forward.
He promised 100,000 tests would be done a day. He didn't mention capacity. It's 100,000 tests would be done a day. Was he lying?
Yes, but the capacity mattered because before we couldn't do the test, more tests.
Yeah,
because
I'm more interested in the number of. I want to know if the Health Secretary is going to meet his own target that he used as a distractionary tool to change the agenda from criticism of the government to a positive. We're going to be testing 100,000 people a day by the end of April. It is now April the 22nd, and we're actually testing less people yesterday than we tested 12 days ago, which I would argue is a spectacular failure. What would you call it?
So we know that testing is really important, and so we have been working hard to ramp up the testing capacity in the country.
Yeah, I don't want to hear about your ramping up, though, Care Minister. With respect, you're not ramping it up. I've just told you you've done 18,000 yesterday, and that is less than you did 12 days ago. So when you keep saying you're ramping things up, actually, you're not. You're going backwards. Do you see?
So we have trebled the amount of tests that we can do since the beginning.
You're not doing them.
People can't get to
them.
You're
doing 18,000 a day, which is less than you were doing 12 days ago.
Well, if you'll let me finish speaking,
you're answering different questions. You keep talking about capacity. I'm asking you how many you've done.
I'm giving you the context and explaining both sides of the equation. One, I won't say it again because you will probably interrupt me, is access, but is the capacity, and the other is the access to tests, and increasing the number of people who are eligible to come forward and get that testing. So we started off with patients in hospital and then NHS workers. We extended it to those working in social care, and that's those in care homes and those providing domiciliary care. I'm looking at whether we can extend testing to personal assistants who are employed by people who pay through direct payments. And we're also extending it to other key workers. So, for instance,
you should have been doing all this weeks ago, with respect, Care Minister. And the fact you're still doing less yesterday than 12 days ago shows me this 100,000 figure was just plucked out of the air and is complete nonsense.
We have a simple message for all countries: test, test, test.